Everybody, welcome to Coffee with John. Looking forward to talking with John Goldman. John, it's great to connect with you. Looking forward to diving into a conversation. You are the CEO and the founder of Rebel Health Alliance. So thanks for being on the show. I love this topic. I'm really interested to dive in, as I think people listening will be as well. If somebody were to go to rebelhealthalliance.io, what they're going to see on the homepage is the following: an elite medical team built around you, personalized medical care, focus on optimization and longevity, guided by your unique biology and long-term health goals. So it appears to me, John, over the years that there seems to be a move to concierge doctor, to the idea of longevity, where really catching things early, understanding your DNA, your nervous system, your body type is really been accelerated, especially by AI as of late. I've interviewed a couple people on the podcast, and we've been talking about that. But let's just kind of talk about the idea of kind of what you do and how it is so curated to the individual.
Sure. Yeah. I think that the trend has been, well, first of all, thanks for having me on the show, John.
Yeah, thanks for being
the trend has been in place now for some time, and there's a reason why, is because the existing healthcare system has completely let everybody down. Right. The evidence is around us everywhere. The skyrocketing obesity rates, even though some have come down a little bit lately, the metabolic disorders, the fact that something like 60 to 70% of Americans are walking around with chronic disease that they're on medication for. Yeah. Everyone knows that you go to the doctor and they really just want to put you on a pill, see you for about 5 minutes, and then send you on your way. And that system may have worked 50 years ago, but it's definitely not working now. And the cost for that continues to go up all the time. So you're getting less service, you're getting more sickness, and you're spending more money. And people kind of are held hostage by a system that doesn't care about them, doesn't have a strategy for their health, and is pillaging their pocketbook every month to take out the maximum dollars they possibly can. And then fighting you to pay in case of a tragedy or accident or emergency room visit. And the acceptance that people have for that is dwindling every day. So then you combine that with COVID and telehealth medicine that kind of took off then, and an explosion in technologies and a democratization of access to advanced diagnostics. And you're starting to get a whole number of macro factors working together to build an entirely new market, which is what we've seen here. Yeah. Our goal when we set out to build Rebel was to build a healthcare system, a full healthcare system that was based around making preventing you from getting sick and making you healthier along the way, while providing great service and having it be cheaper than what it costs to get the silver plan in the ACA marketplace through Obamacare. And so we've been on a multi-year journey to build out what is now officially a 100% alternative to a health insurance model as it stands. We started with the longevity and optimization practice, which was access to advanced diagnostics, forward-thinking protocols, aggressive prevention of chronic disease, using DNA analysis and deep, extensive blood work and VO2 max testing and DEXA scans to really get an idea of your physiology, and then giving you a very tailored plan. And because we believe that food is medicine and movement is medicine, and one of the great crises of our generation is a crisis of sedentarianism, where people just don't move around enough, we have elevated the strength and conditioning coach and the dietitian to the clinical care team for your longevity and optimization protocols. And so your metabolic health founded, foundationally being your muscular build, your cardiorespiratory fitness, and your diet obviously being what you eat and consume. These are the things that are going to have some of the most profound impact on your health for the long term. Wow. And it's a crime. It's a crime that your doctor isn't treating it as a medical prescription when they're talking to people who are suffering from obesity or diabetes. That being said, we can all benefit from being stronger, leaner, and faster. The data is absolutely overwhelming on all of this. It extends your life. It reduces all-cause mortality. It improves all of your metabolic health markers. You can definitely prevent most of the chronic diseases in our age today simply by being lean, fit, trim, and fast. And so the team that we built originally was a doctor you met with quarterly, strength and diet team that you met with as regularly as you needed, and then we would build you a protocol. But the next phase was to add in a primary care practice there. So now we've got our longevity-focused healthcare. with your strength coach and diet and genetics. And then we added in primary care practice as well. So now you can come to us not just for your longevity needs, but you come to us for the cold and the flu and the rash and the weird thing on your toe, so that you don't even ever have to go into the doctor's office ever again. And then the third thing that we did is we added in a
Is that virtual?
it's all virtual. You'd be amazed at how much you can conduct virtually, primary care wise. The only real things you can't do are like look in someone's ear or tap on their belly. If you get a cut or stitches or break your bones, you're going to the hospital anyway. And so then the third piece that we layered on is a financial protection piece. So if you get run over by a truck, or God forbid you have a rare illness or a disease, or in the good on the good side, a pregnancy, now our whole package will also take care of you in time of emergency or unexpected cost. So we've now built the end-to-end soup to nuts complete alternative to the healthcare system that begins with preventing disease, optimizing your health, getting you leaner, stronger, and faster, getting you eating the right things, taking care of your day-to-day needs, and then also taking care of you in time of emergency or crisis. And we are able to do that for less than the cost of what it takes to buy some crappy Care First or Anthem or Kaiser package. And so we've now been bringing this to market, and people absolutely love it, because in the past, longevity was for the rich. Longevity and optimization were for people that could afford to spend 7 or 8,000 or 10,000 or $25,000 on top of the $25,000 to $30,000 a year they're already spending for insurance. We have now completely changed the entire healthcare economics for people, and so you can get care that was once reserved for the pro athletes and the famous, and now you can get it and take care of your family and have financial protection on the downside, all while getting leaner, fitter, stronger, faster, and preventing disease and looking 10, 20 years out into the future. So we're super proud of what we built. It's been 3 or 4 years in the making. We went through this phase process of starting with longevity and adding DPC and now the financial part. And we just started bringing it to market in the last month. Everybody's very interested in it. People are signing up all the time. It's finally the answer to healthcare is broken. What do we do?
Let me ask you a question. So if I'm listening to this right now, I'm thinking the listener is thinking a couple things. One, what if I need a surgery that could be without healthcare, $100,000?
Mm-hmm.
How do you answer that?
Yeah. What happens is you open up what's called a need. In insurance language, that would be like a claim, and depending on the minimum amount that you picked, it ranges from 500 up to 5,000. Anything over that threshold is paid for by the entire community. So we all make monthly contributions into the fund, and then the fund pays out anytime it goes over a certain threshold. Now, the way that we make this work for the community, and we're partnered with a company called Sedera, and they have been around for 15 years with 100,000 members. They're one of the biggest and the most proven health share models in the country. And in fact, their model cannot even be replicated now because of the way ACA has changed the laws and stuff. So it's grandfathered and it's a proven system. Is like you go in for surgery, you get the bill, you send the bill in, and then we negotiate the price down. We call the hospital and we're like, what was this? What was that? Why did you charge this? We know what the Medicare prices are for this. And then we smash that bill down. And then whatever is above the threshold, the community takes care of. So surgeries, cancer.
Wait, what does that mean? Healthcare and the community pays for it?
Yeah. So Sedera is a health expense sharing community. And there's a lot of regulations around what you're allowed to call it because of the lobbyists from the insurance companies don't want people to get confused about it being insurance. But the way it works is that you've got 100,000 people, all of whom have some level of direct primary care and a doctor that they can talk to, then contribute a monthly amount. So like for a guy who's in his 40s, it's about $150 a month that you contribute. And then if any event comes up throughout the year that exceeds a $5,000 threshold, the community just pays for it. They negotiate the price down and they pay for it, and you're only responsible for the 5,000. Now you could pay up a little bit, maybe $200, and have that number come all the way down to say 500. And so then you're taken care of there anytime something happens over $500. And they've never not paid a need. They've never not paid out in a time of crisis for eligible events. They've been around 15 years, amazing retention, great reviews. This is the most proven model outside of the insurance model that works. And it's backstopped by a huge reserve. And there's never been an instance in which an eligible need didn't get paid. But the beauty of it doing with Rebel Health, right, is that we're keeping you out of the hospital. You're not getting sick. We're doing pre-screening. We are doing aggressive prevention of disease. We are fine-tuning your metabolic health. We are treating you for direct primary care issues. We are, keeping you from going from pre-diabetic to diabetic. Do you know
Yeah.
there's 100 million people in America who are pre-diabetic right now? 100 million people. Most of the people, many of the people pre-diabetic don't even know it.
Yeah.
A1C is
How many people
over
know it?
6.
Let
Yeah,
me, yeah, let me ask you a question. So, preventative health, I want to talk about that because I think, I don't think people necessarily are thinking, a strategy plan for my health, a strategy plan. You mentioned that earlier. Um, and sometimes preventative health, I think, can be to many scary, right? So do I want to know X and Y, and so how do you talk to those people? How do you talk to, like, what are the reasons that you want to be preventative and you want a strategy for your health? I mean, it's interesting. I mean, we have strategies for business and we have strategies for so many things.
hmm
And yet sometimes we don't think about the strategy for our health. I have a second company called Life Plan, and I have I have a business coach, but another company I have is called Life Plan, and I built it with my business partner because we realized everybody has these plans, but they don't have a life plan. Nobody
hmm
kind of says, like, they just kind of like go through life. So we built this just great plan, this great book. Same in the same boat. I don't think people are thinking, God, what's my health strategy? And yeah, so how do you guide people kind of out of that into your world?
Sure. So I think one, a lot of people are interested in just preventative care. Like, people are scared of getting cancer, they're scared of Alzheimer's, they're scared of dementia. They already know that they're overweight, they already know that there's family history, they don't want to have a heart attack. And those people, they're already sold. The ones that aren't sold on preventative care and having like a proactive strategy for your health, the way I like to do it is, look, I'm 50 years old. I got 3 kids and I run a business and I've got a lot of duties that I owe to people. And when I look at my daughters and I think about, if I were to die at 55 of a heart attack that I could have prevented, is that the kind of legacy that I want to leave for my kids? Absolutely not. So what I do is, when I'm talking to people, I ask them to talk about the things that are important to them, because health is a metric, it's a number, but then it unlocks
Yeah.
the life that you want to live. And so in our discussions, we're continuously trying to get people to focus on what the good health unlocks for you and what it would be like to have that unlocked for you. Whether you're 65 years old and you had a dream of, like, talk to a guy who wanted to ride his bike around Mont Blanc in Switzerland. Well, he couldn't do it now. And that's why he joined us, because he wanted to get his whole life together so that he could do that. Or a family man with like 3 young kids coming in, and he's like, look, my dad died of a heart attack at 60. I don't want to be having a heart attack at 60 and missing out on my kid's life. Or think about it even more mundane terms. You've got business partners, you've got a job, you've got duties, you've got obligations. And so we try to get people forward thinking and like more visionary and in their head about, what kind of person do you want to be in your community? What kind of father or mother or husband or wife or spouse or son or whatever do you want to be? And then help them see how improving their health and being preventative about their health is going to actually help them achieve their life goals, which
Yeah.
I'm sure is similar to what you do with your life
Yeah.
planning strategy.
Well, the life planning and my business coaching, I think we're kind of in the same business about raising awareness. The way I look at my business is, my business coaching business is, and it sounds like you do the same. You create a space for people to take them to a place they can't get to on their own. They just
Yeah.
aren't making the space for it. And, increasing awareness, I think, is important. I'm a big fan of being preventative. I have been for some time. As I go through your website, or if someone were to go through your website, it lists, what everything you manage, from longevity, optimization, metabolic health, hormones, athletic performance, diet. I mean, the list is very long. And so I don't really like to talk about costs on this, because a podcast can last forever and somebody could listen to this in 5 years and be just as effective. But what for somebody who has a health a health plan with Blue Cross or whomever that doesn't want to get rid of that, but wants to, let's just say, add this on.
Yeah.
What are the, as of the June 2026, what's the investment of that, and what do you actually get, and how do you run all these tests on people?
Sure. So the annual fee right now is $6,970. It works out to about $580 a month or $19 a day. And what you get for that is direct unlimited access to doctors of like Cleveland Clinic caliber training. In fact, literally half our staff is trained at
Wait, can I
Cleveland
ask you a
Clinic.
quick question? Is this like concierge? Like if I wanted to talk to a doctor every day, I could?
Absolutely. You could talk to the doctor every day if you wanted. We have some people that absolutely do that. Love them. They're our favorite. But I think generally
Okay.
what people find is, quarterly meetings, even monthly check-ins, but having just somebody that they can text and talk to and have like a dedicated group chat, because you can do video, you can do phone call, you can do email,
A
whatever you
question for
like.
you. A question for you, just so because I want to kind of understand this. And so, is that 7,000? I'm just rounding up, $7,000 a year per person.
Mhm.
And is that $7,000 a year include all of the tests and the scans and the output, or is that in addition?
The tests are in addition. And the reason that we do that is because everybody's tests are going to be different. Everybody's supplement package is going to be different. Everybody's medications are different. And so, what we do is because we don't sell tests, we don't sell labs, we don't have a supplement line with our name on them. We're like your health fiduciary, John.
Yeah.
We're not going to recommend something for you unless we firmly believe that's the case. So, anybody doctor that's selling you tests or selling you blood, they're making money on that, or they sell you peptides or they sell you supplements, they're making money on that. And so you have no idea exactly why they're recommending it, because that is usually where a lot of these practices make their money, is on the back end selling products into their membership. So what we do instead is we negotiate cash pay prices and heavily discounted wholesale rates with all the providers that we work with, and we just pass that directly on. So for example, our blood panel is like twice the size of Function Health, way better than Superpower Inside Tracker. It's the broadest, deepest blood work you've ever had done. We've got a deal with Quest. It's $450. We don't mark it up. It's direct passed on to you. And that's our foundational battery. The next test layer after that would be like a coronary calcium score, which is a picture of your heart and arteries, $100 cash pay. DEXA scan, full body composition analysis, $200 cash pay. VO2 max testing, cardiorespiratory fitness, $200 cash pay. Those are the tests that most people are limited to.
Yeah.
When you get even deeper, then you can go CT angiogram, pre-novo, Gallery cancer screen. These are all tests that are never paid for by insurance anyway. We get a cash pay price for those, and those can be pricey, right? Those can be into the thousands. But your insurance isn't paying for your pre-novo, like full body MRI, or your Gallery, cancer screening test at any rate.
Yeah. And the nutritional piece, right? You said earlier, food is medicine. And there's some foods that could be pretty poisonous today. I mean, so talk about that. I mean, that's a big piece of it. You can work out like crazy and get all the tests done, but if you're not eating right, talk about that angle, that piece of your business.
100%. We believe that eating is as clinically important as any prescription medication that you might be put on by your physician. So we give everybody a board certified registered dietitian that specializes in longevity and optimization and performance. These are not people with a certificate of nutrition off the internet that they got in just a couple of weeks. Board certified medical professionals. And they read your blood work, they read your DNA test, they talk to your strength coach, they talk to your doctor, and then they craft a custom plan for you. How many calories, what macros, what micros, what to eat and when to eat, rotating calorie days, rotating carb cycling. If you're into training or endurance like I am, I have like 5 different days worth of carbs I'm supposed to eat depending on my workload that week for my training. If you're pre-diabetic, or if you have high inflammation, or if you've got food allergies, we can be very precise in our medical recommendations when it comes to diet. And then, of course, you combine that with the strength and conditioning coach, and you're going to be building the fundamental changes in yourself that are going to lead to the most lasting and reliable outcomes. that people gloss over. Your doctor's like, you should eat better and get some more exercise. See you in a year, but take this statin. Would you? Okay. And that's just like the complete opposite of what we do. And I just want to circle back on one thing when you said concierge medicine. Typically, concierge medicine is faster access to the same old traditional way of thinking. Whereas we don't really like to use that word because we don't want to be affiliated with the old way of thinking. We are forward thinking, optimization focused, prevention focused, muscle building, cardiorespiratory, proper diet focused
Right.
with 5-star level luxury service and direct access. Think concierge like at the Four Seasons front desk.
Yeah. So here's first of all, I love everything you're talking about. But if I'm listening, I would say that you should do a collab with James Clear, who wrote Atomic Habits, because to me, it feels like, how do you work with people to actually change their habits, right? So everything that you're talking about right now, I think if somebody's listening, there are a piece of people that say, I'm on board, I have the discipline and I can adjust. And then there's the person that says, wow, this is so much information. How do I infuse it into my life? And they stop before they even start because of the habit changes almost seem impossible. How do you work with people on that level?
100%. This whole business is all about behavior change management, right? Yeah. And the way that we do that is, first of all, the diagnostics really put in your face can have a serious motivating factor. Most people walk around, I see it every day. I call it casual obesity. Dudes walking around looking like they're probably 20 to 30 pounds overweight, but to a trained eye, they're really like 50 or 60 pounds overweight. And then you get that DEXA scan that comes back at 40% body fat. And then that picture of your heart and arteries that shows the blockages that are going to lead to the heart attack that you didn't think you were going to have. That kind of stuff is highly motivating. But what we do is we make very small incremental changes and know, because we are lifestyle focused, we know that it takes a little bit of change to get some momentum and to keep the next thing flowing. Because once you start feeling better, it starts feeding on itself, and you literally just never want to go back.
I love it. Okay. Quick speed round. Book that made a big impact on you.
Oh, geez. I just had like 10 flash before my eyes, and then I'm like, I don't want to say that one because I don't really. I mean, God, the first one that comes to mind is Atlas Shrugged, but I'm not necessarily like hardcore Ayn Rand. Like I'm not, but like it really taught me a lot about stuff. Peter Attia's Outlive. Let's say that had a huge impact on me. Aggressive prevention of chronic disease, really focused on lifestyle, cardiorespiratory fitness. Huge. Peter Attia had been I know his name is a little toxic right now, but he had a huge impact on me. I followed him since mid 2000s, back when he was a nobody, and so like his perspective on health has been a huge influence on me.
If you could have coffee with anyone in the world, living or dead, who would it be and why?
Oh gosh, the first name was Elon Musk, and then you said dead, and then I was like, should it be Hamilton or should it be Jefferson? How about both? and then I want to work out their differences over coffee.
Okay, good. I like it. One thing everybody can do to be proactive about their health is
get up and eat after you get up and walk after you eat. It's called postprandial ambulation. Best way to lower your blood sugar, help your digestive process, improve your insulin sensitivity. Walk 2 miles a day, minimum.
Love it. Tell everybody where they can connect with you, learn more, and all that other good stuff.
Home base for me is Twitter. It's at John Goldman. I'm on Instagram at John Goldman __. Some other sneaky John Goldman got it before me. And a guy with an underscore, two underscores there. And then rebelhealthalliance.io. But really, like, reach out to me personally. I have built this company. We've got a chief medical officer, operating team. My job is to be the front man, talk to people, bring people in the door, spread the good word. And I would love to hear from you on DM, especially on Instagram or on Twitter.
Yeah. Maybe what we'll do is we'll do another episode and kind of maybe talk a little bit in detail about every test that you actually run for people. I think it could be a real educational thing that we can kind of, educate people on, which would be great.
Would love to do that.
Yeah, John, I think this is great. I think big community. I'll just say this: being preventative. To put it in business terms, I always say there's 3 meetings in every meeting: the meeting before the meeting, and the meeting after the meeting. Same thing in life, right? The preparation is the key, and being preventative is so important. Being preventative has saved my life, and I can point to it very clearly. And I think it's really important for everybody. If John can help you, please reach out. And of course, if I can help you, reach out at johndwoskin.com. And John, we'll have you back. I'm looking forward to it. I appreciate it.
I would love that, John. My pleasure. Thanks for having me on, and thanks for listening, everybody.
Thanks, everybody.